assessment, it is important to note that a lot of things can be observed from your patient in a subtle manner. So as you can see, I don't have my patient yet because I need to observe how she's going to report to the clinic, how she responds to my question, because these will be my basis for my findings. Okay, if you're going to study your portfolio, you will find that the assessment of the neurologic functions is actually divided into 6 segments. For today, we're going to demonstrate to you most of these 6 subdivisions of the assessment. We start with the assessment of the level of consciousness, followed by the assessment of the cranial nerves, and then assessment of the cerebellar function, specifically your motor function, sensory, and lastly your deep tendon with assessment of level. For this procedure, I'll be needing the patient gown, a tuning fork. Okay, you remember your tuning fork in the assessment of the ears, a reflex hammer. Okay, it doesn't matter what type of reflex hammer you're going to use, but if you have an access to a long reflex hammer, that will be better. By the way, this is called a Taylor reflex hammer, and it is the most common in the Philippines. We will be also needing tongue depressor. Later on, we're going to test for the cranial nerves, cotton balls. So I've prepared several cotton balls here, again for the cranial nerve assessment and for the sensory sensation. Pen light, you remember your pen light, right? And an object which has a sharp and a dull side. So we're going to use a paper clip. And for the dull one, I may have to use a cotton tip applicator. So we'll find later which is more appropriate to our patient. All right, so those are the things that we're going to need today. As you can see, we're not including the Snellen chart, the ophthalmoscope, and the other equipment that we use to assess the eyes because these have been covered in the previous demonstrations. Okay, so the first step is to, of course, explain the procedure to your patient once she arrives. Okay, as you talk to your patient, you have to observe how she responds, how she states her answers, and her facial expressions. Okay, we always start with the assessment of the level of consciousness. Good afternoon, ma'am.
Good afternoon, sir.
Okay, I'm the nurse in charge in this clinic. My name is Jet. May I know your name, please?
I'm Edita Sabalbo, sir.
Can I call you Miss Edith?
Yes.
Okay, Miss Edith, how was the trip so far? How are you?
I'm fine. The trip meaning what? Through what trip?
What did you do to arrive here at the clinic?
Okay. Of course, I waited for a cry for me to come here. Then I reached the school after 5 to 7 minutes.
Mm-hmm.
And then upon arriving at the guard, I do the health protocols like I take my body temperature and sanitize my hands.
Oh, I see. That was quite a trip today. And this assessment that we're going to conduct today, this may take several minutes, maybe a little less than 1 hour. Do you have plans afterwards?
Of course, my plan is for me to continue accommodating the students for the written demonstration. There are still students who are not done with the written demonstration. So after the lecture discussion and demonstration of neuro and hospital, then I will have I will accommodate the students who are not yet done with the written demonstration.
I've heard that you've mentioned students over and over. May I know your occupation, ma'am?
I am a clinical instructor of pharmacologist.
Where? Normal College. Okay. All right. So, did you hear the questions that I asked our patient? So I really hope that you were able to take notes when I was interviewing the patient. Why? Because the way she responded, including her speech, her facial expressions, they will all have to be observed for this assessment. Okay. So the first step in your learning portfolio is to assess the level of consciousness. In the PDF guide that I have uploaded, it's stated there that you're going to use the GCS to assess the level of consciousness. Okay, that's not exactly true. The GCS, which comprises of 3 responses, your motor, verbal, and eye responses, they are more appropriate for patients who are in a critical setting. For example, a victim of vehicular accident or a traumatic injury. Now, for this patient, since she appears to be well, she's not a victim of anything, it is more appropriate if you're going to assess or describe the level of consciousness using your ALOSC. Okay? So there's an acronym known as your ALOSC. Okay? These are the 5 levels of consciousness. The highest one is letter A, which indicates alert. This means that the patient can respond to questions. She opens her eyes spontaneously and she moves spontaneously. A little less is your lethargy. Okay? Lethargy is not the letter after F. Lethargy means the patient is sleepy but still can respond to questions or stimuli. Letter O stands for obtunded or obtundation. Okay? A person is obtunded if she is sleepy, but you may need to stimulate her a little bit for her to answer. Okay? So it's similar to your lethargy, except that the stimulation requires more intensity. Okay? So you may need to raise your voice a little bit louder, or you may need to tap the patient's shoulders or body for her to respond. Okay? But the keyword here is, for an obtunded person, she still responds. Next, your stuporous. The difference between an obtunded and a stuporous patient is that a stuporous patient is sleepy, but she will not respond to any stimuli except that she will open her eyes. Okay? She's not going to answer your questions. If you shake the body of this patient, she's going to open her eyes and then goes back to sleep. Okay? She doesn't respond differently. All right? And lastly, letter C is comatose. Comatose is for patients who do not respond at all at any type of stimulation. Now, because my patient is not a victim of a traumatic injury or event, I'm going to describe her level of consciousness using this description. So, with regards to my patient, I would say she is alert. Okay? So that's for the level of consciousness. Second, check for the patient's appearance and behavior. So under appearance and behavior, there are a lot of things that you should have checked. Number 1, the patient's posture and body movements. So as she was walking a while ago and as she is sitting now, try to observe how does your patient look like. Okay? Normally a person must be relaxed, okay, while sitting with an erect posture. So my patient is sitting upright with good posture. Okay? Abnormal findings would include if the patient, for example, has poor posture, has a lumped appearance. This could indicate that the patient has feelings of powerlessness, hopelessness, which are associated with depression. Okay? Another abnormal finding that you would observe in some patients is if the patient has unusual or erratic body movements, okay, which is consistent with schizophrenia. Next, aside from posture and body movements, also check for the patient's grooming, dress, and overall hygiene. Normally, a person, when she comes to the clinic, she is well groomed, she is neat, and she is wearing appropriate attire, okay, for the situation. So, with regards to my patient, she knows that this is a physical exam. She is wearing appropriate clothes. I think these are work clothes. Okay. Consider if the patient came from work, she might not appear as clean as you are expecting compared to a person who just come from home, right? Okay, a person who comes from work usually have a little bit of sweat, a little bit of hair out of order, but that is expected. Okay? Because if you observe that the patient is unusually meticulous with her grooming, suspect that this patient could have an obsessive compulsive disorder. On the other hand, if the patient has poor hygiene or poor grooming, this could be associated with several things. Consider the patient might be demented. She might have dementia. Second, she might be depressed. Third, she might have schizophrenia. Okay? Consider these reasons if the patient has poor or unkempt hygiene. Okay, what else? When you were talking to your patient, you should have observed the facial expressions. Was she able to maintain eye contact? What was her affect? Okay, so a while ago, while I was talking to Miss Edith, she was able to look at me in the eyes while I was asking her questions and when she was responding. This is an appropriate and normal response. If a person averts her gaze or avoids eye contact, this could mean that this patient has either depression, or she may be is apathetic. Okay, you know, she doesn't feel any emotions. Okay, what else? When a person normally talks or normally responds, she uses the appropriate facial expressions. If she is happy, she will smile. If she is annoyed or irritated, probably she might frown her face a little bit. Okay, so the keyword here is appropriate facial expressions. Okay, if the person, on the other hand, has exaggerated facial expressions, perhaps the patient is anxious. Maybe she is having an anxiety attack. Okay, what else is there? While you are talking to your patient, you should also observe for the speech, okay? Particularly the clarity and pacing of the speech. A normal person speaks with a moderate tone and a moderate pace. Okay? But if the patient speaks in a slow, repetitive manner, this could probably a sign of Parkinson's disease. If, on the other hand, if the patient uses an unusually loud voice and extremely fast pace, this could mean that the patient has mania. Okay? Mania meaning a bipolar disorder. Okay? So those are the things that you could assess under appearance and behavior. Third, you're going to assess for the mood, feelings, and expressions. Okay, for this question, for this assessment rather, you should have asked the patient how was she feeling. Okay, basing from there, try to evaluate the way she responded to your question. Okay, normally a person is friendly and speaks positively. Okay, a while ago my patient seems to be cheerful and she answered my question in a positive tone. Okay, take note of that because if a person has persistently negative tone in answering, this could probably mean that this patient is depressed. Okay, what else? Observe also how she responds to the question, what are your plans after this? Or what are your plans in the future? Okay, this is a test to evaluate how the patient sees other people or future events. A while ago, my patient says she has plans to continue or resume her work. Okay, I did not sense any negativity there, and this is a normal response. All right, next, fourth, assess also for the patient's thought process and perception. Now, for this question or for this assessment, you need to ask the patient a question that triggers the thought process. You know, how would she reason? Okay, and for my example, I asked my patient to describe how she arrived at the clinic. So she was able to describe how she described her commute. Okay, in short, she was able to describe her commute. And her answers were all realistic, simple, and clear. And this is a normal finding. Okay, and lastly, you're going to assess for cognitive abilities. So this time we're going to ask the patient a lot of things, okay, a lot of questions. We'll start with orientation. Orientation meaning, does the patient know where she is, what time of the day it is? Okay, Miss Edith, can you tell me what day it is today?
Today is May 19, 2021. Past 1 o'clock in the afternoon.
And what day it is? What day is it?
Today is Wednesday.
Okay, correct. So my patient was able to answer my question. In other words, she is oriented to time. You can also assess orientation to place. Miss Edith, where do you think you are right now?
We are here at Normal Colleges.
All right, thank you. And she is also, again, oriented to place. She was able to identify her location and her place. Next, assess the patient's recent and remote memory. Miss Edith, can you tell me what you had for lunch?
Rice and fish.
Rice and fish. Oh, sounds yummy. Can you remember the first time that you were in a hospital? Can you describe it for me?
First time in a hospital, that's when I gave birth to my first child.
Ah, you gave birth to your first child. How many children do you have? How many children do you have?
I have two.
I have you. Okay, I see.
Two
All right.
boys.
Thank you. Okay, for this test, you're going to ask a question for the remote memory. You're going to ask a question that is from the past. Okay, make sure that you know your patient's past medical history for this. She must be able to answer realistically and correctly. Okay, next, check the patient's cooperation, or rather concentration, okay? Assess the patient's concentration. Now, for this test, I'll be needing the patient to wear a gown, okay? And observe how she does it, okay? Miss Edith, I need you to wear this gown with the gown facing in front, okay? You have to wear it with the gown in front. Okay. While the patient is doing this, observe how she executes, okay, the step. Okay, thank you. She was able to do it. Let me help you with this. Oh, you can do it? Okay, very nice. An alternative way is to ask the patient to pick up a pen. Okay, please, you may take your seat now. Okay, Miss Edith, I need you to hold this pen in your right hand.
Right.
Okay, now hold it into your left and give it to me, please. Okay, and this result therefore means that the patient is able to follow directions correctly. Okay, and she has focus. She can listen to instructions. What else can you assess here? You can also check for abstract reasoning. Okay, abstract reasoning. So a simple way to do this is to ask the patient to explain a motto, maybe, or a proverb. All right, Miss Edith, can you tell me how would you explain the golden rule?
The golden rule states that do not do unto others what you do not want others do unto you. So meaning to say, you should not do things that you think might hurt others, because you yourself wouldn't like that that thing will also happen to you.
Okay, thank you very much. That was a pageant level explanation of the model. Okay, so remember, for abstract reasoning, the patient must be able to explore the idea. Okay, and she will be able to explain the motto or proverb correctly. Something else that you need to assess here is the patient's judgment. Okay, so you have to ask a question which puts the patient in a scenario, a specific scenario. Okay, for example, Miss Edith, if you are in, if you witness a car accident, okay, let's say a child was hit by a speeding car, what would you do?
Um, the first thing I'll do if I am on that situation, most probably, is to call for help. If I can get some information as to the number of a hospital, or the city health office, most probably, in order that they will be able to respond immediately to the accident.
Okay, thank you very much. That was a well thought answer. Okay, so for this test, your patient must be able to explain in a realistic, okay, the keyword here is all her answers must be grounded in reality. Okay, it must be real, it must be appropriate for the scenario. So a while ago, I asked her what she needs to do if she witnesses a car accident, and her responses, in my judgment, are appropriate for the scenario. And lastly, Miss Edith, I'm going to test your visual perception and your constructive ability. So what I want you to do is to draw the face of a clock at 3:45. Can you do that? Okay, so I'll give you the marker. 3:45. Okay, I'll give you the marker and please draw it on the whiteboard. Let's pretend that it's a perfect circle. 3:45. All right. Thank you very much. Can I have the pen back? You may sit down, Miss Edith. Okay, so as I can see, my patient was able to construct, or draw rather, a clock correctly indicating the time that I asked her for, which is 3:45. Okay? And the last one is to check if the patient can use new memory to gain information. Okay, Miss Edith, for the next 5, 10, and 30 minutes, I need you to memorize 3 things for me, okay? I'll be asking you to repeat these things after 10 minutes and at the end of the assessment. Okay, so you can repeat the word after me. The first word is red rose.
Red rose.
Okay, the second word is blue sky.
Blue sky.
The third word is, what should we say? Yellow flower.
Yellow flower.
And the last one is black fruit.
Black fruit.
Okay, can you repeat the things that we said? What are the four words?
Red rose.
Okay.
Blue sky. Yellow flower.
Yes, and the fourth one?
Black fruit.
Okay, so at this point, my patient was able to recall the words that I told her. Now you're going to ask the patient to words after 10 minutes and after 30 minutes. Usually for middle adult patients, they should be able to repeat these 4 words, okay, at the 10th and 30-minute interval. For older clients, it would be acceptable if she can repeat 2 or 3 out of the 4 words. Okay. Next, we're done with cognitive abilities. Now we're going to check for the cranial nerve. Okay, so cranial nerve assessment. Now, for this neurologic assessment and in your return demonstration, it is noted that some of the cranial nerves have been assessed in the other demonstrations. So for your return demonstration, we're going to exclude your cranial nerve number 1, your oculomotor nerve, your cranial nerve number 2, your optic nerve, your 3, 4, and your 6. Okay, your oculomotor, trochlear, and your abducens nerve. Okay, we're going also to exclude the facial nerve. Okay, that's cranial nerve number 7, cranial nerve number 8, your auditory nerve, and and that's it. Okay, so for your return demonstration, you don't need to demonstrate how to assess cranial nerve number 1, 2, 3, 4, 6, 7, and 8. Okay, so 7 of the cranial nerves will not be demonstrated. But just to review to you, what are the 12 cranial nerves? A mnemonic that you can use is OOO to touch and feel every velvet. I'm trying to avoid the other word. Okay, every velvet heaven. Okay, so you can use a mnemonic such as OOO to touch and feel every velvet, every girl's very good velvet heaven. Okay, or when we were students, we have a naughty mnemonic which is OOO to touch and feel every girl's vagina so hot. Okay, which an easy way to remember the 12 cranial nerves. Okay, so aside from remembering the name of the cranial nerve, you should also memorize the function of the nerves, whether it's a sensory nerve, a motor nerve, or a mixed nerve. Okay, so a mnemonic that you can use this is school. Se se mo mo mi se mi mo mo. Okay, so you can sing it in the tune of London Bridge is Falling Down. So that is se se mo mo mi se mi mo mo. Or when I was a nursing student, we used to have this mnemonic. Some say marry money, but my brother says big brains matter more. Okay? So you can use either of this mnemonic to help you recall what is the name of the cranial nerve and what type of nerve it is, whether sensory or motor. Why is it necessary to name or to identify what type of nerve the cranial nerve is? This will help you remember what test are you going to perform. Okay, so we'll start with cranial nerve number 5, trigeminal nerve. The trigeminal nerve is se se mo mo mi. It's a mixed nerve. Ibig sabihin, it has a sensory and motor function. So we start with the motor function. For the trigeminal nerve, what we need to do is ask the patient to clench her teeth. Okay, clench her teeth while we try to palpate for the temporal and masseter muscles. Okay, Miss, I'm going to check on your cranial nerves. Okay, for a while, let me apply alcohol to my hands. Okay, so what I want you to do, what I need you to do, is to clench your teeth. No, you can keep your mask on. Okay, please clench your teeth, and I'm going to place my hands on your temples. Okay, please don't stop clenching your teeth if I don't say otherwise. Okay, so while she's clenching her teeth, try to feel for the temporal muscles. They should be contracting symmetrically, meaning if this is contracted, the other side should be contracted as well. And the masseter muscles, which are just below the what's this mastoid, along the mastoid region. A mastoid, no, mandibular, I should say. Mandibular angle. Okay, so in this area, it should feel contracted as well. Okay, while the patient is clenching her teeth. Okay, ma'am, you may relax now. Okay, so the key word here is there should be a symmetrical contraction on all of these muscles. All right, next we're going to check for the sensory function of the trigeminal nerve. The trigeminal nerve has 3 roots, therefore it affects the forehead, the cheeks, and the chin. Okay, so to check for the trigeminal nerve sensory functions, you're going to need a blunt and a sharp object. Okay, so for my blunt object, I'm going to use the blunt side of the paperclip, which is this, and for the sharp one, I'm going to use this one, the other end of the paperclip. Okay, so before you begin the test, introduce to the patient how the blunt part of the paperclip feels and how the sharp one feels. Okay, Miss Edith, I'm going to check for the sensation on your forehead, cheeks, and chin. Now, I want you to remember how this feels like. Okay, this is sharp. Okay, did you feel that? This is a sharp sensation. Now, this one is a dull or a blunt sensation. Okay, now what I want you to do is to tell me whether what you are feeling is sharp or dull. All right? Okay, for this test, you need to assess both sides of the forehead, cheeks, and chin. And the patient must be able to say whether the sensation is sharp or dull. Okay, so remember, the patient's eyes must be closed. Okay, let's begin. Tell me what this is.
Sharp,
Correct?
dull, sharp, sharp,
Okay.
dull,
Can I lower your mask a little bit?
sharp, dull, dull.
Okay, so my patient was able to distinguish between the sharp and a dull sensation. Another function of your trigeminal nerve is the corneal reflex. So for this test, we're going to need a cotton ball, okay, a wisp of cotton. For this test, you should create a wisp. Okay, so you twirl the end of the cotton ball like this. Okay, so you have that. Now you're going to touch the patient's cornea using this wisp of cotton ball. The patient must look on the opposite direction of the side that you are assessing. For example, I'm going to assess the left side. Okay, Miss Edith, I'm going to touch your cornea using this cotton ball. I need you to look at the right. Okay? Now normally when you do this, the patient must blink. Okay, that is the corneal reflex. Okay? Can you open your eyes a little bit wider? No, your eyes, just your eyes. All right? Okay, so okay, how about we try looking medially? There we go. Okay, she is blinking spontaneously. Right, this might be difficult. Okay. All right, for a while. Can you open your eyes a little bit wider? Okay, she has. All right. Okay. The problem here is she was blinking while I was touching her eyelashes, which makes my findings a little bit less accurate. What you need to do is to touch the cornea. Okay, there we go. Okay, thank you very much. All right, now let's try again. Touch the cornea of your patient, and you must observe for a response. Okay, so she was able to blink with the wisp of the cotton. Repeat the test on the other eye. I want you to look on the opposite direction. Try looking upwards one. There we go. Okay, touch the cornea. Try looking over at the side. Okay. Okay, and she was able to blink. So a positive corneal reflex is present, and that is a normal finding. Next, we're going to check for cranial nerve. We're going to skip cranial nerve number 7 and number 8 because they were already demonstrated in the previous lab demonstrations. So we're going to skip for cranial nerve number 9 and number 10, your glossopharyngeal and your vagus nerve. Okay, so for your cranial nerve number 9 and 10, you need to assess them together. Okay, so for this test, you're going to inspect the uvula, the soft palate. Okay, if their contraction or their movement is symmetrical while the patient says ah. Okay, so since we're going to assess the mouth, I need to wear my gloves and my tongue depressor and my pen light. Okay, give me a few seconds. So for this test, you need the patient to open her mouth. Okay, and as you ask the patient to say ah, okay, a long ah, observe for the movement of the mouth structures. Okay, let me get my pen light. Okay, I'll do this first without the tongue depressor. Let's see if my patient can show me her uvula and her soft palate. Okay, ma'am, please open wide. Your tongue, can you put it downwards? Okay, if she cannot do that, you can use a tongue depressor to, well, depress the tongue. Okay, push down on the tongue, all right? And inspect the mouth while the patient says, ah. Can you say ah?
Ah.
Longer?
Ah.
Okay, very good. So you should look at how the uvula and the soft palate moves. They should move symmetrically. Okay? So meaning equal dapat yung direction ng dalawang structures. All right. Next, ask the patient to swallow. Okay? So we need the patient to swallow. Miss Edith, I need you to swallow for me. Okay, and tell me, is it painful for you to swallow? Can you do it?
No.
Okay, very good. Because normally there should be no difficulty or pain when swallowing. The medical term we use to refer to difficulty in swallowing is dysphagia, right? Next, we need to check for the gag reflex. So using the tongue depressor, you need to press at the back of the mouth and observe if the patient will gag. Normally, the patient will gag. Okay, so please open your mouth wide. Okay, I'm going to test if you're going to gag, all right? Please relax your tongue. Okay. All right, so thank you. My patient was gagging, and this is a normal response. Okay, whenever the back of the throat is touched, she will gag. Okay, as soon as you notice that the patient is about to gag, stop and remove the object. Okay, so that your patient will not vomit. Okay, we don't want the patient to vomit. All right, so that is for your cranial nerve number 9 and cranial nerve number 10. For cranial nerve number 11, I'm going to remove my gloves now because I don't need them anymore. I'm going to check for the letter S, spinal accessory nerve. Okay, for the spinal accessory nerve, we're going to check the patient's shoulders. So, can the patient lift or raise her shoulders against resistance? Okay, so Miss Edith, I'm going to push down on your shoulders. I need you to push back. Okay, so you're going to test here, can she resist the force that you are exerting? Normally, she should be able to. Okay, let's start. Shrug your shoulder. Okay, very good. She was able to raise her shoulders against resistance. Okay, one more. I need you to push my hand. Okay, so please look at the right. Now I'm going to push your chin towards the right. I need you to push against it. Okay, so turn your head towards the left. All right, let's start. All right, okay, so she was able to do it from the right. Next. Now look at the left. Now push my hand away. Okay, very good. And my patient was able to do and follow the instructions. All right, so these are normal findings for your spinal accessory nerve. Okay, if the patient is incapable or unable to do this, suspect that the patient has a probable lesion in her cranial nerve number 11. Now lastly, for cranial nerve number 12, your hypoglossal nerve. For your hypoglossal nerve, you only need to observe for tongue fasciculations. Okay, if the patient's tongue is vibrating abnormally. Okay, so for this test, we might not need a pen light anymore because it's well lit. So Miss Edith, I need you to open your mouth again and stick out your tongue, please. Okay, thank you. And you have to observe for the movement of the tongue. There should be no excessive vibration or twitching movements from the tongue. We call this your fasciculation. Okay, so far, Miss Edith, all of your cranial nerves appear to be intact. And this is a good news. This is a normal finding. Now we're done with cranial nerve assessment. We proceed with the cerebellar function, starting with motor function. Now most of the motor functions will be assessed later on during the musculoskeletal demonstration, but we're going to check for three things. Okay, if the patient can perform, or if the patient has muscle coordination. Okay, Miss Edith, I need you to stretch out your arms at the side. So do it like this. Now touch your.
Can I stand? Or
would you prefer to stand up? That would be okay if you wish to stand. Okay. Now I want you to stretch out your arms. This time with both of your eyes open, and touch your nose using your index finger. Okay. There we go. How about the left one? So please remove the. As you do that, remove the other hand. There we go. Okay. Can you do it? Very well. Now I need you to do it with your eyes closed. Okay, thank you very much. All right, so normally the person must be able to perform this maneuver, touch the fingers using the tip, touch the nose using the tip of the finger simultaneously, okay? Right, left, and vice versa. Okay, next, you're going to ask the patient to touch the thumb using the fingers. So with her hands, focus on the patient's hand. She must be able to do this. All right, so this is fine motor assessment. So the patient must be able to touch the thumb with her other fingers. Okay, Miss Edith, I need you to copy what I did. Please touch your thumb with your fingers. Pinky, okay. Can you do it with the left hand? Okay, maybe in your return demonstration, your patient will not be trembling so much. You can do it with the hands on the lap. Okay, so let's try to do it again. Okay, I can see that there are several trembling movements here. Have you had coffee this morning? Okay, probably this could be a result of the caffeine. All right, so we observed that there's a moderate pace while the patient does this. Now, Miss Edith, I need you to do it in a faster pace. Can you do it? Okay, on the left hand. Very good. All right. So even if you increase the pacing of this maneuver, the patient must be able to still touch the thumb with her fingers without missing anything. Okay? Next, you're going to ask the patient to turn the palms down and upwards while they are at the lap. Okay, Miss Edith, I need you to turn your palms up and down while they're at the lap. You don't need to remove it from your lap. You can simply do it at your lap. Okay? Can you do it? Let's increase the speed. Very good. Okay, thank you very much. You can stop now. Okay, so as you can see, my patient was able to follow the directions. She was able to supinate and pronate her palms quickly and with moderate pacing. Okay, next, I need my patient to lie down for the heel to shin test. Okay, so Miss Edith, I need you to lie down, please. Can I move it to the table? There we go. Okay, now Miss Edith, please, I need you to touch, using your right heel, I need you to touch your left shin. Okay, so using the heel, touch your shin. Okay, and do it on the opposite side. All right, so can you do it 2 more times? So the patient must be able to perform this maneuver without any difficulty and without experiencing any pain. Okay, I have 5 minutes left. All right, next, we're done with the motor and cerebellar function. As I've said, the rest of the motor functions will be assessed in the musculoskeletal assessment. Okay, so we proceed with the sensory functions, starting with your light sensation pain sensation, and temperature sensation. Okay, Miss Edith, I think it would be best if you're going to sit. Okay, thank you very much. Okay, as you can see, my patient is able to prop herself up without any assistance, which is really promising. Okay, we start with light sensation. So for this maneuver, you're going to need, once again, for the sensory function, we're going to test the cerebellum. So our focus here are the extremities, so both the hands and the lower extremities. Okay, so using the cotton ball, make a wisp again. Now, Miss Edith, what I am going to do here is to touch different parts of your body using this cotton ball. I need you to tell me when you feel the cotton ball, okay? Just to show you, this is how it feels. Can I lower your gown for a little bit? Okay. Just to give you a sample, okay? This is how it feels. Can you feel it? All right. Now, Miss Edith, with your eyes closed, say now. Say the word now as soon as you can feel the cotton. Okay, so when you're doing this, you're going to assess bilaterally the hands and the feet, or the legs rather. Okay, let's start.
Now, 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 now.
Okay, how about the feet? Can you stretch out your feet, please? Or leg rather? May I push this a bit? Okay, there we go. Is it okay if we remove your shoes temporarily? Okay, now for the lower extremities, do the same. Assess the feet. Maybe it would be best if I remove this one, okay, so that your feet are hanging freely. Okay, again, say the word now as soon as you can feel the cotton.
Now, 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 now.
Okay, so very good. So normally a person must be able to feel the sensation since the dermatomes are spread across the upper and lower extremities. All right, next, assess the patient's sensation to pain. Okay, so you don't need to stab the patient. All you need to do is to prick the patient with something sharp. You can use something like a broken tongue depressor. So for example, if this is your tongue depressor a while ago, you can break it in half to have a dull, a blunt, and a sharp end. Or you could simply use a paper clip. So this will be the sharp end, and this will be the blunt end. Okay. Again, just like the cotton ball a while ago, ask your patient to tell you whether she feels a sharp sensation or a blunt sensation, okay, as you touch the upper extremities and the lower extremities. Okay, Miss Edith, say sharp if you can feel this. Can you feel this?
Yes.
Okay, and
Sharp.
say that is sharp, okay, and say blunt if you can feel this.
Blunt.
Okay, all right, let's begin. Let's start with your arms.
Blunt. Sharp. Blunt. Blunt. Sharp. Blunt.
Okay, very good. So the patient was able to identify the pain sensation on her upper extremities. Let's do it on the lower extremities. Okay, again, tell me whether it is sharp or blunt. We need both feet to be hanging freely. Okay, so I'm going to remove this. Let's start. What's that?
Sharp.
Okay, correct.
Blunt. Blunt. Sharp. Blunt.
Let's try that one once again.
Sharp.
Okay. Don't peek. You have to close your eyes. Okay.
Yeah, my eyes are closed.
And last one. What's this?
Blunt.
Okay, very well. Okay, so my patient was able to feel the sharp and blunt object both on her arms and on her lower extremities. And lastly, sensation to temperature. So for this, you're going to prepare, I forgot to mention a while ago, you need to prepare two, in your portfolio it says test tube. So you can use two test tubes, one containing a hot or warm, lukewarm water, and one that contains cool water. Now for me, I'm going to use gloves for this, since gloves are more elastic. Okay. Now, Miss Edith, this time I need you to tell me whether what you're feeling is hot or cold. So this is how the hot feels. Okay, it has cooled off actually time, but this is how it feels. Okay. and this is the cold. All right? Now, let's begin with the client's eyes closed. Repeat the maneuver using a hot and a cold fluid. Okay.
Hot, cold, cold, hot,
Okay, very well.
cold, cold,
Okay. She was able to identify it correctly. Now let's do it with her feet.
cold, hot, hot, cold,
Mm-hmm.
cold.
Okay. Maybe it's because my gloves already has cooled off, so it's actually
Cold.
difficult to distinguish at this point. It's almost tepid.
Cold,
Okay.
cold.
Yes, you are correct. All right. So my patient was able to distinguish between the hot and cold sensations. Okay, class. I need to stop temporarily because I have an important meeting with the dean. My co-instructors are going to take over and continue the assessment of the neurologic functions. So we will continue with the test for vibratory or vibration sensations. Okay, please give us a few seconds to reorganize. Meanwhile, while you are waiting, please. Oh, we'll end the video, sir. Okay. All right, so there will be a part 2 for this demonstration to prepare the necessary equipment and the person is going to demonstrate. So we're going to end this live video for a while, and please remain on standby because part 2 will be right up. Okay?